The next question I want to address is the association between neighborhood and health. That is, why neighborhood has additional effect on health, uh, setting aside the individual SEP, that is, socioeconomic positions or socioeconomic status. Why do other socioeconomic positions have anything to do with my health? That is a paraphrase of that question. There are a couple causal pathways from neighborhood to individual health outcome. First of all, poor neighborhood obviously is associated with less resources. So individuals' utilization and deployment of resources is affected by the total amount of resources available. Okay. So in other words, using what is called confluence model, that is the confluence of multiple rivers into a bigger one, or even into the ocean, or to paraphrase it, interpret using more concrete terms, individual's health is affected by the total environment. For example, if there's a poor neighborhood, and very likely there are pockets of food desert, which is obviously associated with lack of access to healthy food, thus leading to poor health. Second, for example, lack of public transportation is associated with stress. Lack of fitness facility is associated with low level of physical exercise, and even lack of parks and the kind of areas that people can have for recreational activities and simply for walk is associated with lack of physical exercise, and in turn leads to poor health. Also, poor neighborhood has fewer, on average, fewer healthcare facilities, thus leading to a lack of access to regular healthcare. Also, poor neighborhoods tend to have high crime rates, so residents living in those neighborhoods more likely to become victims of crime. Thus, they're associated with poor mental and physical health. Okay, so in general, poor neighborhoods are associated with less resources. So it's not just about individual resources that can be deployed, utilized for health enhancing activities. Note that individuals don't live in islets. Okay? They are living a well-connected life, and they have needs from others. So if all others in the neighborhood don't have enough resources, that's going to in turn affect the individual of interest. In this case, his or her health. Second, poor neighborhoods are more likely to have a high level of social disorder. This is associated with the first causal pathway we just talked about, right? Poor neighborhoods are more likely to have all kinds of problems and have less resources, thus leading to a high level of social disorder. And social disorder leads to psychological distress, right? Fear, anxiety, low self-esteem, and depression, and all kinds of mental disorders. Okay. Also, in poor neighborhoods, more likely to have this Matthew, or what is called amplification effect, meaning rich get richer and poor poorer. Sometimes it is interpreted as cumulative disadvantage or advantage effect. That is, more resources can be more easily mobilize to get much more resources. Okay, so if a community has more resources, then the ability to mobilize to get more resources is increased. Okay, Matthew effect. Also, in a poor neighborhood, as well as rich neighborhood, there is this contagion effect. That is, healthy and unhealthy behavior can spread or be acquired or learned. When there is critical mass of individuals that adopt such healthy or unhealthy behavior.